Second lecture for the day, defenses. So what are defenses? Obviously, defenses, as the name suggests, is a defense against something. So what is that something we are trying to defend against? And obviously, we don't do it consciously. There are very few defenses which we do consciously. Most defenses operate unconsciously. Right? So we will see what we can do consciously and what we do unconsciously. Defense is in the psychic realm an action of the ego, and therefore usually we use the two words synonymously, defenses and ego defenses, believing that ego is the one responsible for coordination and homeostasis within the mind and between the organism and the environment, and therefore ego is the one who would be using ego defenses. It will be using defenses, and therefore it is called ego defenses. So what are they? Defenses are dynamic actions deployed by the ego for various purposes. What are these purposes? First, ego defenses can be used for enhancing pleasure. Right? For example, somebody is in a manic state and he says something which is untrue and you speak something true. The information that you give will be immediately put into a corner and repressed or devalued so that the manic state can continue. Right? Or defenses which are used in the dream so that the dream can continue and the pleasure can continue. Like Freud says, dreams don't disturb sleep. Dreams are the guardians of sleep. So, defenses can be used for enhancing pleasure. Defenses can be used for avoiding pain, which is the most common thing in pathology. That you repress the painful memories. And these painful memories usually involve the affects, which I call the seven musketeers: anger, fear, pain, right? Anger, fear, pain, guilt, shame, envy, and either inferiority or narcissism. So this is the most common use of defense. Defenses are used. Third purpose is to maintain psychic homeostasis, what Jung calls compensation. Jung's statement is too much on one side leads to too much on the other. Meaning, if there's too much in the conscious, a balancing will happen in the unconscious. If there's too much in the unconscious, balancing will happen in the conscious. For example, if somebody appears very, very masculine, right, in the outward life and does not have any integration of femininity inside, his dreams will be populated with feminine symbols. Right? It's an act of compensation. Right? So Jung says too much on one side leads to too much on the other. If in the conscious there is too much of one quantity, right, opposite of it will populate the unconscious. What Jung calls the principle of compensation. Right? So this is one way of attaining some sort of homeostasis. Homeostasis is also attained by regulating difficult emotions. Say, for example, sublimation. Right? You convert aggression into a productive activity. You convert narcissism into a Nobel Prize winning activity. Defenses can be used for enhancing progress. For example, whenever we want to do something great, we have to use masochism in an enlightened way. Without saying goodbye to convenience and lot of pleasure, we can't do anything great. To do anything meaningful, you have to do it dedicatedly for a reasonable period of time. And for that time, you have to say goodbye to the alternatives. Because in the same time, you could have watched the movie, you could have been with friends, you could have taken good food, whatever. All those pleasures, we have to say goodbye. And it's a conscious use of masochism for a greater purpose. So that those defenses at that time of repression, of deactivation, of focus, of diversion, they are used to enhance progress. And some people also talk of evolution. That there are some defenses which strengthen or weaken over a long period of time in accordance with evolution. Now, why are we looking at it? Because defenses are two-edged swords. One, they help us to keep ourselves healthy, to enhance pleasure, reduce pain, and so on. On the other hand, defenses can easily become a problem. And wrong defenses, which are entrenched in a pathology, they often are one of the first problems to solve. And defenses often repress the affect from coming up. So most common use of defense is to repress the affect in some way or the other. And when we do therapy, we know how difficult it is to get feelings out, how difficult it is to negotiate past the defenses which are guarding those affects. So usually defenses, they guard the affect. They don't allow the flow of affect, and therefore they become dysfunctional when we talk of healing of pathology. Even more complicated thing occurs when affect itself is used as a defense. Right? For example, let us say a patient of depression comes to you and he has a problem of too much of sleep. And the moment you hear too much of sleep, the first thought that comes to our mind from analytic perspective is it has to do with bottled up sadness. If it was aggression, he will come with too little sleep. So depression with too little sleep is usually bottled up aggression, and too much sleep usually is bottled up sadness. Let us say he comes to you and you realize it's bottled up sadness, you start therapy, and then you ask him to get in touch with the sadness, and he just can't. The moment he tries to get in touch with the sadness, he becomes extremely anxious. So defenses there don't allow the sadness to come up, and therefore they hinder the healing process. And healing process take a lot of time because we have to negotiate past those defenses which are well entrenched. And they are now old friends of the person. They have been there so long. It seems very natural to the person. This is one way defenses work, that they hinder our work of healing. And we have to get past those defenses. Second is when affect itself is used as a defense. For example, somebody comes with a depression with weeping spells, that I just can't stop crying. I cry, after another 20 minutes, I feel good, again I cry. After 20 minutes, again I cry. These weeping spells just don't stop. And at the first sight, it looks we are dealing with a lot of sadness. But that is not correct. Actually, affect is used as a defense here. And these weeping spells are a cover up for anger which is inside. And that is the difference between genuine weeping and weeping as a defense. When there is genuine weeping, after the weeping is over, you feel very light, very purified, very good. But when you have spells of weeping, you don't see that salutary effect. Because it's a defensive weeping, covering up anger. So this is a more complicated and misleading thing, that the presenting complaint may be a false complaint. If you try to treat that presenting complaint, you will go on the wrong path. It just won't respond. And then we will conclude the patient is resistant. he is not resistant. We have not identified the real thing. The real thing is the bottled up anger, and we will see the moment you start focusing on the anger and make him feel it and let it go, the spells of weeping automatically stop. And that is the proof of the concept that affect was used as a defense. So what I call the sandwich of affect, that you have an affect which is covering up the real affect inside, and then there is an affect below it. So often we find this stacking, this sandwich of affect, that the top which is presenting itself may be one of the many genuine affects, or it may be a defensive affect. So what we see here is defense, first situation, defense not allowing affect to come up. Situation 2, defense using affect as a defense. That what is on the top as an affect is actually a defense against a more difficult affect inside. Uh, this is like misleading the person who is trying to heal. You present something so eventful that the healer gets lost in that eventfulness. And behind that eventfulness, the real core stands protected. And this many times will happen in case of sociopaths with addiction. They will make the narration so eventful that you will get lost in the analysis of that event. And every session, they will come up with a very interesting story, something very eventful. The real thing is just allow it to pass and just get to the core, and the core will come up. It cannot not come up. Intuitively, you will know. So, defenses can become a problem when they prevent the flow of affect. Defenses become even greater problem when they use affect as a defense. And there are two types of defenses we will study today. General defenses, which are operated every day in health also and in pathology also, and some special defenses which are used only in dreams, which usually we don't use in everyday life or even in pathology. So let us go into it. So let us look at first the general defenses. So there is a long list. I have selected 15 of them. You can have a longer list, but this 15 should be enough. The first two defenses are the most common which we use. The first is denial. I don't have any problem. And second is diversion. And the first can go into a lot of sophisticated ways. So denial, I don't have any problem. I don't want to come for therapy. My parents sent me to therapy. My doctor sent me to therapy. I don't have a problem. My family members have a problem. And this can even be where parents bring children for therapy, and we have to tell the parents that the child is okay, you have a problem. So the first defense is of denial. And this has to be gone into some detail. Denial can be simple, right? Or it can be complicated. Can you think of a complicated denial? We analyzed it once. Complicated denial will be like making the lost object our own by identifying with it. Let us say one of the parent dies. So then what happens is certain qualities of that person or certain actions of that person now are done by the living. It is a way of denial. That because those actions that he used to do are still happening, he has not gone away. It's sophisticated denial. What we see in the Psycho movie. Freud has a very good paper on it called Totem and Taboo, where he talks about how certain tribes have this custom of eating the dead, that there is a ritual in which small components are consumed. And I had given an example of a Japanese man who had cut his wife to pieces, put in the refrigerator, and would eat one piece every day. And when he was caught, he said this was an act of love in order to avoid separation and to be one forever. Of course, he was psychotic, but he concretized what, in a metaphorical way, a normal psyche would do. So, sophisticated denial will be that one undergoes a modification so as to make small part of oneself mimic something like the lost object. So the loss of the lost object can be denied that now it's a part of me. It can also be inheritance of value system. That what the father or the mother believed, now I believe. So this can be a sophisticated roundabout denial. In one group of patients, yeah, please.
Can we not, how do we differentiate healthy commemorialization when one inherits the values, inculcates them by identification, laborious process, and does make progress? And how do we differentiate it from denial that is pathological?
From the outcome to you, which it is related. Because all the defenses can be used for healthy purposes also.
Yeah. Okay.
And all the defenses are used by everyone in different measures. It is not that certain defenses are used only by the psychotic or the neurotic or the personality disorders. Everyone is using everything in different proportions in different contexts. Now, based upon the context and proportions, we will call it healthy or pathological. So, denial also has one group. There will be one group of patients who are very fragile, and because of capacity constraint, they will have no choice but denial. So, in that group of patients, the first goal of therapy is to enable the patient to accept that I have a problem. Because the sheer fact of accepting I have a problem, that disintegrates the inner equilibrium. So the most difficulty they have is to accept that I have a problem. That these are definitely not the patients of ISTDP. Because in ISTDP, we start the session by saying, what is the internal emotional problem I can help you with? So first, the person has to accept what is the problem. Now that itself may be a problem for many people, especially fragile narcissism. That the, yeah, please.
With this term fragile narcissism very well.
Can you repeat? It's getting lost in the network.
I wanted to raise this point that inability for denial also makes somebody vulnerable, and he will say yes to every negative interpretation or painful interpretation that somebody gives. And
Correct.
then that makes them miserable actually.
Correct. Correct.
So absence of denial as a problem also can be there.
It will be true for everything.
Yeah.
Like everything has to be operated in that healthy zone.
Yeah.
Hypo is a problem, hyper is a problem. So denial for a group, the core will be, there will be a group where the core problem is to accept I have a problem. And they will take a long therapy to come to that stage where they can comfortably say, yes, I have a problem to be solved. Let us look at that problem. Right? And most of them will eject out of therapy. Like recently, I had a person, I had referred to somebody. So I referred that person to somebody, and after 2 sessions, the therapy stopped. So I got in touch with a common friend who was common friend of me and that person who was going to therapy. And the common friend told me he talked to her and she said there is no problem. When in fact she was suffering for years and she had asked me to find out a therapist. But the moment therapy started, after a few sessions, she said, yeah, I don't have any problem. So this is where the fragility comes in. So that group will have no choice but denial. And in such group, we have to accept denial for a long time till the capacity is built up. Because if we try to oppose that denial, it will be the end of therapy. Second is diversion. That this is for you and me. That we have enough insight not to indulge in denial, but we will indulge in diversion. We will think about everything in the world but not solve our problem. So if we have a problem, we will not dedicate 1 hour to the problem every day. We will divert our mind to everything else but our problem. So this is the most common thing, diversion. In therapy also we see. The person talks about everything but the problem. So diversion is very, very common defense. Third is suppression. This is a conscious defense. Denial can be conscious, may not be conscious. Usually it is not conscious, but it can be conscious. Diversion can also be both conscious or unconscious. Suppression is conscious. It is like I have a desire for alcohol. I know it is not good for my body, so I suppress it. Repression is unconscious. A desire emerges in the unconscious and is repressed in the unconscious. Consciously, I don't know about it. Right? So, desire emerges in the unconscious, repressed in the unconscious. The conscious is unaware. Yes, please.
Suppress or repress only the idea or the emotion and the idea both?
Both.
Both.
There can be a situation where both are repressed
Hmm.
and somehow idea escapes,
Hmm.
right? But the affect remains unconscious. This is very common in case of changing addictions.
Hmm.
That a part of idea and even maybe a part of affect escapes and one addiction is healed, but a large part of affect remains unconscious and after some time it finds a new addiction. Or even in obsessions, it finds a new obsession. Somebody who is washing hands now checks the locks. So this is very common that the whole thing may escape or a part may escape. Somatization. That when feelings are very strong, right, and they cannot be dealt with efficiently by defenses. This defense is, it's a very destructive defense. But it also tells us that the environment is so repressive that the man has no way but to deal with it by somatization. It's like a no choice situation. Right? Just as psychosis is a no choice situation. Right? That the environment is so difficult and emotions are so much that there is no way out but to create a parallel reality. That given the reality as it is, within that nothing can be done. So there is no way out but to create a parallel reality. Similarly, this is a kind of no choice situation. Right? That for a very common thing, aggression, right? You can see it somatization in terms of uh, inflammation issues, allergy issues, right? Diabetes, blood pressure. Right? So very and India, it's very, very common because a large section of population has no way out but to repress the emotions as much as they can. And then after some age, the buckets are overflowing, so there's no way out but somatization. Yeah.
I feel also the above four defenses of denial, diversion, suppression, repression can also lead to somatization.
So what will happen is that they will be used, right? And when they are insufficient, right? So let us say you put in repression, right? So when you repress, let us say out of the bucket 20% is filled. The events keep happening, the repression keeps happening, another 20% is filled. Someday the bucket overflows, and then the body does not know what to do with that overflow. So the system decides to somatize. So repression will be a kind of universal defense, a long acting defense, and somatization will be a much later uh, event which happens in most cases. Right? In some cases, you may see this even in early childhood. For example, early childhood asthma. Right? The emotions generated are so high because of the split being open and sensitivity being high that the body does not know what to do with it. And therefore, part of it is somatized and part of it goes into other psychological symptoms. So you can have parallel thing that part of the overflow goes into producing psychological symptoms and part of it is somatized. So the man has depression and blood pressure both. Anger is going in both the directions. Somatization we saw the other day that sadness when it somatizes, it produces mucus related problems, what in Ayurveda we will call cough related issues. Anger when it somatizes, it produces pitta related issues involving inflammation, right? Involving destruction. And when anxiety somatizes, it creates what kind of issues, leading to dryness, leading to arthritis, leading to the wearing away of the cartilage, things of that type. Too much of dryness, breaking of the skin because of dryness. Sixth defense, rationalization. I am not good enough is maintained this way, right? That the parent attacks the child, but the child rationalizes to say, he has done it for my own good. That because I am not good enough, I have done A, B, C, D. Therefore, he did this, otherwise, he is good. So, that is rationalization. It can be used even to justify one's narcissism which has failed. That it was only because I did not have A, B, C, otherwise, I would have been on the top of the world. So, the narcissistic movement is frustrated and you have to rationalize it. And I am not good enough is maintained. Because if I evaluate the other on merit, I will have to conclude he is not good enough. And if I conclude that, it will lead into a loss, and the loss is terrifying. So, to avoid loss, I have to maintain that he is good enough. But his actions are such that somebody has to take those actions, responsibility for those actions. So, I make myself guilty. I keep myself, I am not good enough, so that the other is good enough can be preserved and loss can be avoided. So many times I am not good enough in dependent personalities is preserved using rationalization.
Fear of loss of love and fear of loss of object are two different things. No, loss of love is supposed to be more mature, neurotic, whereas loss of object is more immature,
Yeah, correct. And
something like that.
that is true. The outcomes are very different.
Mhm.
Like loss, the object loss will produce far deeper and lasting impact than the fear of loss of love.
Loss of
Also, there is lot of hopelessness and helplessness associated with object loss, which often may not be associated with loss of love. Like loss of love may involve hopelessness that in future I won't get somebody equally good.
Mm.
But it's not necessarily always true. And that hopelessness also is easy to overcome. But this object-related hopelessness is difficult to overcome. And in personality disorders, this is very common. Object loss is a core element in most personality disorders. And therefore, most personality disorders will involve some sort of rationalization, either to maintain the other is good enough or to maintain I am good enough. So in narcissistic disorder, we'll see I am good enough being maintained despite one's failures by rationalization. Right? And in dependence and in histrionicity, the other is good enough is maintained by self-attack and taking it on oneself. Similarly, in case of abuses, physical abuse or sexual abuse, often I am not good enough and guilt and shame of oneself is rationalized. Guilt and shame directed at oneself is used for rationalization so that the anger towards the other can be avoided. That there's so much of anger towards the abuser, but because of reality, morality, one does not want to express it. It's avoided by rationalization, by self-blaming. So the guilt and shame that he should be feeling, the victim feels.
This is definitely not a healthy defense. It's much more pathological than in that sense.
Uh,
Otherwise, rationalization we usually suppose is neurotic defense.
yes, when it is like used to explain the natural limitations of life.
Uh-huh. But
Like,
here, for example, in sexual abuse, and people don't report,
yeah,
so there is too much of a
correct,
pathological
true,
rationalization.
true, very true. Then you have intellectualization. In this defense, we talk about an event except talking about feelings involved in the event. So you will have a patient report a traumatic event logically. Right? He will report everything but not talk about feelings involved. We call it intellectualization. And when this becomes 24/7, like somebody may not report the emotions while narrating an event to a therapist, that is one situation. But 24/7, he just does not feel anything. He says, earlier I used to laugh at this thing, now I can't laugh, I just don't feel anything. So there we use the term isolation of affect. Now that is also a defense. Now isolation of affect is partly involved in intellectualization also, but that is more circumscribed. It is not universal generalized. Projection. This defense is used, yeah,
Well, this is just an observation, but these days, I think this intellectualization is becoming very common as a defense.
true, very true.
Especially as I observe in, I think, younger generation so much more.
That is true.
So they talk of the issues very objectively, very
Yeah.
logically, very objectively, or associating it with some philosophy or some theory or something,
So they
rather
talk,
than
yeah,
talking of the feelings attached to the whole thing.
they talk of the feelings, but they don't feel the feelings.
Yeah, exactly.
This is the whole trouble, right? That people say, I am angry. So this is what we do in ISTD. The patient says, I'm very angry. So we say, you say you are angry, but you don't look angry. You're not feeling that anger. If you are really feeling that anger in this moment, you will look very different. So you are not here to hold a conference on anger. You are here to feel anger and detox the system, right? But everyone wants to hold a conference on anger. So this is what we say, you say you are angry, but you don't look angry. You are in touch with the word, you are not in touch with the feeling. You are in touch with the word which is representing that feeling. It's not the feeling itself. So this is a very important point today, that people talk a lot about feelings, they don't feel the feelings. And one of the reasons is the fragility. That fragile narcissism has become so prevalent, right, that the fragility does not encourage them, right, or does not assure them that they have the capacity to feel. And the environment is also such that the environment promotes intellectualization. And the full-blooded feeling of the feelings is looked upon as something not upmarket. I am reminded of how the death ceremonies in USA often are done. When they go to the grave, they wear those goggles so nobody sees them weeping. Now that's the height of masking the emotions. If you go to an Indian setting, you will see people crying aloud. And the more rural you go, you will see a more blatant expression of emotions. The lower you go in income, you will see a more blatant expression of emotion. Can you say it again?
Facial expressions are also seen.
Yes,
Diwalis, you pay them to cry because the ritual has to be.
true. So it's a social catharsis, social therapy. That culture creates such conventions that a therapist comes to your home and you undergo a group therapy along with your family. And the convention is, if you don't cry, people say, what a shameless person this man is. So even if you don't want to undergo therapy, you still want to undergo therapy.
You still?
Have to undergo therapy.
Yeah.
So cultures evolve their own practices to tackle important turning points in life, like birth, entering into puberty, marriage, separation, death, the important points of life. Projection, difficult to accept things in oneself, we put it onto others. Simple example is a child who tells the mother, you are angry with me, when in fact the child is angry. So you put onto the other difficult to accept emotions in oneself. Right? Now, a broader defense of which this is a particular specific expression is at number 10, displacement.
That's the need for dependency, and I feel the world is cruel. Is it an
Say,
example of projection?
say it again.
If I have high dependency needs and I believe that the world is cruel,
Huh.
is it an example of projection?
No, it is assessment driven by high sensitivity and very different standards.
Mhm.
Right? But let us say uh, independence, I can't live without him. And I
Mhm.
project that he can't live without.
Mm.
And someday that projection is broken. So in dependence, what will happen is the assessment that the world is cruel is because of high sensitivity and high standards of the dependent person. Because the positive aspect of dependence is very high sensitivity and very high nobility. It's a personality structure cut out for NGO work. Hello?
Very sensitivity and
High sensitivity, high nobility,
ability. Mhm.
and very high people orientation.
Mm.
So they want to see everyone happy. They want uh, to see everyone good. So it's a personality structure cut out for NGO work. So they are very noble in heart and they are extremely sensitive. So the normal standards are enough to hurt them. They find this world very rough and coarse. Right? So what can upset them? Because the average aggression of a man is brutal to them. So there's a very high difference in sensitivity of the ordinary person and a dependence driven person. Similarly, they get hurt very easily and they find it very difficult to forget that hurt. And one of the most difficult parts about dependent personality is to get the anger out, because the fear of losing the other is so high that despite how much somebody has hurt, they find it difficult to feel that anger fully, even in therapy.
Activity and expectations.
Correct.
That is my personal experience and observation. But I don't know if this will make a crossing boundaries because I'm in the class and
नहीं कोई
I'm
बात नहीं, please go
sharing
on.
personal experience. Thank you, sir.
So after projection, we have the projective identification. Now this is slightly different from projection. In this, what happens is you project something on a person and you actually make the person feel it. Like, let us say, I am angry at someone. I can project it and say, you are angry at me. But he does not feel angry at me. I feel he is angry at me, but he does not feel anything. In projective identification, I put that emotion inside of him and he actually starts feeling angry at me. Now, we don't know how this mechanism operates in the mind. But anybody who has done therapy knows this is true. Right? And often we ask the person, for example, in the middle of therapy, I start feeling angry. And nothing has happened in the communication that can
Mm.
provoke anger. So it's an
Mm.
unconscious transfer from the patient to me.
Mm.
Right? So I ask the person, what are you feeling angry at?
Mhm.
And suddenly the conversation was about something else, and now an anger conversation comes up.
Mm.
Right? So he is transferring to me, right, unconsciously what he finds difficult to articulate consciously. Right? So that is projective identification. Right? That
Can come to transference and reading it and articulating it to the patient so that he can
yeah.
bring it
So
up.
there is a
Great.
difference between counter transference and projective identification.
Uh-huh.
Right?
Uh-huh.
For example, let us say in projective identification, what the patient feels, I directly feel.
Yeah.
In counter transference, the patient transfers something to me and I respond to it in a different way. So the transference is different from counter transference. What is
Yes.
coming in, right? That I directly don't feel. I feel my response to what is coming in. Right? So let us say there is a female patient and there is an Oedipal transference.
Mm.
Right? So the girl sees me as a father figure and I start seeing her as a daughter figure.
Mm.
Right? Or she is sexually attracted to me and I start feeling that attraction. I start responding to it.
Mm.
Right? So what happens is in transference, T1 comes in. And in response to T1, I feel T2. Now I don't know T1, I know T2. From T2, I deduce T1. From counter transference, which I know, I deduce transference. Okay? At times, somebody can be clear about it in verbal terms, that I actually see you like a father. Right? So it's very clear what the transference is, but usually I deduce it from counter transference. So T2 is counter transference, T1 is transference. So T2 is different from T1. In projective identification, the person feels T1, I feel T1 directly. And this can happen in
Understood.
very strange ways. For example, one, as I said, you start feeling the feelings. That can be one. A second example, in psychosis, after the session, you can have strange visuals, which is the material put into you by the psychotic patient and he goes away. He leaves it for you to process because he can't process it himself.
Yeah.
Let me give an example. Once after the session, about 2 hours after the session, I started having strange visuals, not hallucinations, visuals in the inner world of shining silvery worms. Many worms, very uh, shiny and disgusting, sticky worms, they are over each other, moving over each other, whole bunch of them. It was a heap of silvery, sticky, yucky worms.
Mm.
So this was what the patient had left me to process.
Mm.
Right? So it is a way of infantile communication. That this is something I am struggling with. Right? I cannot process it. I can't even get in touch with it. My conscious dare not get in touch with it. But this is what you have to solve. So now metaphorically, what it means is a completely different thing. Right? How to deal with it. But it is projective identification, a special kind, what is I call delayed projective identification. That you don't feel it right at the moment, you feel it after some time. Let us take another example of even more sophisticated projective identification. You forget a session. Now you don't forget session of everybody, but one particular person you forget the session twice.
Mhm.
So he has put into you the problem that I have been taken for granted and everyone forgets me, nobody remembers me. This is my core problem. My core problem is that people don't recognize, don't acknowledge my existence. So it's a severe mirroring problem. So then the cohesion method comes in
Mm.
because you have forgotten the session twice, and when you reflect upon it, you realize it is not because of any objective reason. It is not a general trend. You forget sessions only of this person. So he is communicating to you and actually making you do it. Like if the projective identification is very strong, you actually are forced to act upon it if you are not well trained. That take another example. A person has a lot of abandonment issues. He has been repeatedly abandoned and uh, he puts anger into you, he irritates you. So the moment the therapy is going well and the closeness is developing, he is afraid of closeness. He is caught in that traffic jam. I want closeness, I don't want closeness. So he irritates you, and when you get angry, he tells himself, look at what he has done. So he is repeating a known situation, he is re traumatizing himself, right? And he is also testing you. Right? That others have attacked me, abandoned me, let me see what you do. Let me test you. So there the holding capacity and the awareness of therapist comes in. Displacement. Displacement is a very generic defense. In fact, projection, projective identification, they are all specific forms of displacement. This is the capability of the mind to transfer emotion or thoughts from one entity to another. And this is the stuff of dreams. It's a very generic defense. For example, somebody is afraid of water. What has happened is an innocent object has now become a phobic object because fear from some other object has been transferred onto this innocent object. So displacement there will be at the root of that transfer. Transference. It is also one particular kind of displacement, but it has a role element to it. Right? That one transfers in therapy feelings, ideas related to emotionally significant people of the past onto the therapist. And mostly it is related to the parents, spouses, brothers, sisters, close friends. So feelings related to one are transferred onto the other. The defense of transference. Reaction formation, going into the opposite. Right? When the sadness increases, one goes into a manic state. Right? Higher the mania, higher is the sadness defended against. So bipolar 1 mania means the sadness inside is very high. Bipolar 2 means sadness is moderate. Somebody starts laughing at the funeral. Reaction formation. Distortion.
Or excessive politeness when one feels angry actually
Correct.
within.
Correct. So when something is unacceptable, you
Yeah.
take refuge in the opposite of it.
Antithetical emotion.
Correct. So this is reaction formation defense. Distortion. Right? You can distort what somebody says, or you can distort your own ideas about somebody. Rumination. Keeping repeating the same thing over and over again intellectually without allowing the feelings to come. So rumination is a very good defense to defend against usually anger, fear, and guilt. Sorry, anger, sadness, and guilt. Right? Mostly it's a defense against these three affects.
Mhm.
Splitting, it's a very primitive defense where you look at something in extremes. So you look at somebody as extremely good or extremely bad. Now, some people invoke splitting in others. For example, Narendra Modi. You will have people who extremely love him or extremely hate him.
Mhm.
You will have very few people who have balanced view of him.
Mhm.
The personality is such, it evokes split responses.
So borderlines, the family environments of patients with borderline personality,
Right.
these environments they promote splitting,
Correct.
and
Similarly,
therefore the borderlines experience all good or all bad.
similarly, there are cultures which promote splitting, and there are cultures which promote integrated thinking. And Jung made this observation. Jung's own statement was that the products of Western culture always will be neurotic because there is no place for integration. It's a binary thinking framework. Right? So the God is all good and the devil is all bad. But in India, you will have very complex figures. Like Ravana is very knowledgeable. He has done a lot of tapasya, but then he has a difficult part. Kali Mata will destroy demons, but she is a blood drinking goddess. So this integration happens, extreme brutality, and you worship that brutality because of some extreme good inside. Whereas in the West, you see this binary thinking of the God and the devil.
Patients like this, clarity at the cost of complexity, digital thinking. And this is how I talk to them that you have digital thinking, I am analog.
Correct. So
And
this is
that
what happens.
often works.
Yeah, this search for simplicity. Right? And taking refuge in a split thinking for simplicity is also at the root of terrorism. That the mind of the terrorist does not find itself adequate to deal with the complexity of the reality as it's outside, and in which he has no place otherwise. Right? So if he has to satisfy his desires, his narcissism, create his perfect world, the only way out is regression to the golden past, where things were simple and the split could operate. So this is a very immature difference in a way, a very psychotic defense mostly. But everyone uses everything. But in psychosis, we see more of splitting. Now, some defenses which are used in dreams, not commonly. In dream, substitution happens. Like, I have erotic thoughts about a woman, but I don't see that woman, I see some other woman. Condensation. Two people become one, two objects become one. Let me give an example. In one of my dreams, there was a lift, and the lift was huge lift. It was 15 feet by 15 feet lift, size of a room, and white cushions were kept on the lift. Right? And this actually was a condensation of two things. I used to visit a place where I would go up into the lift. Right? Every week I would go to that place, and just opposite to it was a sari shop where all those white things were kept, cushions were kept, and on this the saris were shown to customers. So that shop and the lift got together, and I had this strange 15 feet by 15 feet lift with all the white cushions and going down. So this is condensation. Role reversal. The boss becomes the employee and the employee becomes the boss. Symbolization. I see a tiger in my dream, and he may stand for the dominating father, or he may stand for my own aggression. Right? And the same symbol may have different meaning in different dreams for the same person. Right? And for different people, of course, it will be different. But there are some commonalities that usually tiger will be for aggression, snake will be for something edible, unless reaction formation is used. If reaction formation is used, then a gentle rabbit may actually be a symbol of aggression. Inversion, like you see something upside down, that there is a road and cars are moving below it. Right? Or something seen upside down in the dream, inversion. Surrealism, this O has to go. Surrealism, that the dream, sorry, I can't hear you.
Please.
Yeah, Salvador Dali.
Really.
Yeah. So the dream appears very, very surreal, right? Nothing related to reality. It really is a dreamy landscape in the dream. Right? So surrealism can be one defense. Omission. It's a defense difficult to find, that something which is not there in the dream, which obviously should be, right, is the defense of omission. Let me give an example of real life. I was in an ISTDP workshop, and everyone talked about everything, but did not mention anything about Habib Davanloo, the founder. So I pointed out this Oedipal rage, this Oedipal death wish. And I asked the speaker, why this Oedipal death wish? Because here we see annihilation by absolute omission. Right? And this would be a kind of omission, that the rage is expressed by annihilation through omission.
You may, but certain dynasty had this tradition that the father emperor was killed by the sons. all the time.
Yes,
All the dynasties were like that,
correct. So the
living out,
Oedipus,
living out the Oedipalities.
so there is the Oedipus at play, and there is this objective struggle at play. Both work out. So these are some of the defenses which are used in dreams, not generally used in other situations. And in dreams, apart from this, all the normal defenses are used.
Hmm.
The defenses which here, this 15 plus this 7, all the 22 are used in dreams. But in normal situation, apart from dreams, these are usually not used. Because this is almost like, looks a psychotic kind of thing. And we can easily go psychotic only in the dreams. Now let us just look at quickly in healing and defenses before we stop for the day. Some people, a group of therapists, they focus on the ego and defenses for healing. So they say, if you can strengthen the defenses enough and use the right defense in the place of wrong defense, right, the healing will happen. So the focus is on defenses, right? So the group is called ego psychology group. And Anna Freud and Hartman have done a lot of work in that group. Okay? They will say the goal of therapy is to substitute immature defenses by mature defenses, or neurotic defenses instead of psychotic defenses. So they will define healing in this way, their focus will be this way. They will focus upon the strength of defenses and the appropriateness of defenses. And they will put a lot of emphasis on sublimation. It's a very constructive defense. So I have narcissism, I channelize it to winning the Nobel Prize. I have anxiety, I channelize it, right, into educating people for insurance. Somatization, they focus upon as one of the most difficult problems. And they say that pathology emerges when there is a failure of defenses, or when there are too many defenses against affect, or when affect is used as a defense. And in Bionian thinking, which is quite apart from ego psychology thinking, he talks about defense against right knowledge. He calls it minus K. If K is knowledge, right knowledge, minus K is resistance to right knowledge or presence of wrong knowledge. And he talks of that as one of the core defenses which we have to undo in case of psychosis. Because Bion looks at psychosis as a cognitive issue, not really as an affective issue. Very different way of looking at psychosis. So with this, we can stop for the day. Any questions?
Nitya asmita raga dvesha viniveshaha panchakleshaha.
Correct.
So, like what the last sentence you said in the previous slide was avidya, wrong
Yeah,
knowledge.
at the root is just avidya. Right? And this leads to a very good question actually. Okay, do thoughts lead to feelings? Do feelings lead to thoughts? Or is it a bidirectional traffic? Right? So, like for example, hello?
And Purana was the teacher and the examiner that time.
Uh,
And if there was perhaps an article by him, but there was no explanation of this. What comes first? If you could give me, I will be very happy.
yeah, I'll give it. It's a tri-directional flow. Now let us look at how it happens. One, let us say somebody is having, CBT says thought leads to feelings, leads to behavior. Right? That first you have a thought that something is dangerous, then you feel anxiety, and then it leads to behavior. Right? TFB. That's their premise. So in many cases we see this is true. That thoughts lead to feelings, lead to behavior. Right? This is one flow. Thoughts to feelings to behavior. One flow. Now let us look at the second flow. Somebody is afraid of heights, and the behavioral therapist says, I am with you, let us slowly climb. You start with 2 stairs. After 2 days, you go to 3. I will be with you. I will hold you. Right? And slowly, over a 3-month period, we will do 20 stairs and then look down, nothing will happen. And let us say the man is healed. Right? Out of 10 people coming, let us say 2 are healed. So in those 2, what has happened? Behavior has led to feelings, has led to a change of thoughts. In some cases, it will be behavior leading to a change of thoughts, leading to a change of feelings. Second direction. Right? Third direction. Somebody has obsessive thoughts. He comes to a psychoanalytic psychotherapist and he says, if the Oedipus is resolved, these obsessive thoughts will stop. Right? So the Oedipus is attended to, catharsis happens, and after the catharsis, the obsessive thoughts stop. So what has happened? Feelings have led to a control of thoughts. Till the feelings were blocked, thoughts were continuing. So feelings lead to thoughts. Right? So what we saw, feelings lead to thoughts in psychoanalysis. Behavior leads to thoughts in behavioral therapy. Behavior leads to affect in behavioral therapy. Thought leads to affect in cognitive therapy. Affect leads to behavior in cognitive therapy. So it's a tri-directional flow. So these are some of the examples how we can see how tri-directionally, which means neither CBT is fully correct, nor behavioral is fully correct, nor psychoanalysis is fully correct. It actually is a tri-directional flow.
And experiencing a particular thought or emotion, what do we experience first? Do we experience the feeling first or the thought first? That
Usually,
Shachter-Zinger theory, Shachter-Zinger, and
usually it is the thought.
uh,
Usually it is the thought in ordinary circumstances. If the feeling generated is very high, then the feeling overwhelms us and it's only later that we can think about it. So it's also a non-exponential situation, that it is like what we used to have equations in mathematics, that x is equal to 2x plus 1 if x is less than 5, but x is equal to 5x plus 5 if x is more than 5. So it's that kind of a non-linear exponential situation, that till a quantum of effect is generated, it is thought first. When that quantum crosses a particular line, it overwhelms, it's the feeling first. It's only after the feeling subsides that we are really able to think coolly about that event. Okay, should we stop for the day? Thank you so much.